Now I'm going to show you how to do a muscle approximation on the erector spinae muscles. So we already did this on the gastrocs. You can employ this on any muscle belly. It works really well on muscle bellies that are long, so you could do this on the hamstrings, you could do this on the quads, you could do this on the tibialis anterior, you could do this on the triceps or the biceps, anywhere where you can kind of get a pincer grasp and pull the two ends of the muscle belly together, which squeezes those muscle spindle cells and creates a relaxation in the muscle. When we do these on the erector spinae muscles, we choose a small portion. So we might be doing this because they have really tight erector spinae muscles. Maybe it's you're not able to really get in with a lot of digging, sort of muscle stripping kind of petrissage techniques. Maybe they have too much spasm happening in the muscles of the back, and so we're just going to choose a small portion. Or maybe they have pain in their ribs, maybe they have a rib injury, so you can't really press down on the back. This would be a really great way to do this technique. So I'm going to show you with my knuckles, because that's how I do this technique. So let's say there's a portion of the thoracic erector spinae here that are, say they've got a rib injury or something, and these are all really hypertonic and tense in here. So what I'm going to choose, I'm going to palpate them. I'm going to say, oh, you know, this is kind of the tightest spot right here. I could use my fingers, I could use my thumbs, but remember the erectors are very deep in towards the spine. So I like to use my knuckles, one knuckle or two knuckles possibly, and then I sink into the tissues here. So making sure your client is breathing always. I'm going to sink into the tissues here. Remember, you have to go through the trapezius and the lats and the rhomboids and the serratus posterior superior and superior and serratus posterior inferior. You have to go through many, many layers of muscle here. So you're not going to get there quickly. Nobody's going to get there quickly, even if you've been practicing for years. Take your time. Sink all the way in. Now I'm feeling like I've gotten to a good depth here. I'm making sure that my pressure is about 2 pounds and that my joints are stacked. So now that I feel like I'm at the right depth, then I bring the sections together, and you can see it's almost like squeezing those erectors together. And so then we wait for the release. So I've approximated the muscle. I'm waiting for the spindle cells to send a message to the central nervous system saying that they're not in a state of tension anymore and that they can relax. So we hold it again 30 to 60 seconds or until you feel a relaxation. Some people's nervous systems are highly wound, and you may feel a release happen right away. It may be that you do this technique many times and you don't feel anything for a while, but remember that we're practicing on people who don't generally need these treatments when we're practicing in school. But remember what the indications are. These are for to reduce muscle spasm and tone. So if you come across somebody who is in a state of muscle spasm and you employ one of these techniques on them, you're going to see a marked difference versus working on somebody who's not in a state of spasm. So as soon as I feel a release, then I slowly let go and come out, and you may even see your knuckles there. Remember, you don't use oil for these techniques, and that's a muscle approximation for the erector spinae.